All right, welcome back. We are live. Today, we're going to be talking about cannabis and chronic illness and how you can navigate some of the symptoms that you may be experiencing or know somebody that might be experiencing. Now, this topic might be a little vague, but I got Dr. Kennard here with me, and he's going to dive further into some of the main chronic illnesses, such as pain, stress and anxiety, insomnia, muscle spasms, and even nausea and poor appetite. So, without further ado, we're going to dive into the science behind cannabis and how we can start to alleviate some of these chronic illnesses. So, Dr. Kennard, let's talk about the first one first and foremost. I think this is the most common one that people tend to medicate for, and that is the chronic pain. So, can you tell me, what type of cannabis products, dosing, strategies, things that are most effective for those who are experiencing chronic pain?
Sure. Well, thank you, Brittany, and welcome, Facebook Livers. Appreciate your joining and getting informed on the topic. Hopefully, I can help you with that. The beauty of cannabis to me is that although there are all these individual conditions listed, including chronic pain, which is pretty broad, in chronic pain, you're talking about anything that causes pain and suffering beyond a 3 to 6 month period after that tissue should have healed or you should have gotten resolution of whatever the illness was. That includes anything from just daily headaches and all the subtypes of headaches, fibromyalgia, osteoarthritis. You don't have to have a traumatic injury where a muscle and bone was injured and nerves were injured to have chronic pain. It really is based upon where you feel it and the fact that it didn't respond and it's affecting your emotional and physical function. So it's really broad. So that is why the number one indication for the medicinal use of marijuana is chronic pain. Number two is anxiety, and number three is insomnia. Unfortunately, those latter two, anxiety and insomnia, are not approved themselves. We're working hard on that. Hopefully have some good news in March that those get added. So, but to take chronic pain, it's more complex than just the pain that you feel. I practiced chronic pain for 15 years, and I've seen the full spectrum, and I've seen the full spectrum of who responds to what. And the truth is, it's individual. We have a lot of drugs outside of opioids to use. Some people just respond better to opioids, and that's what they need, and they're responsible taking them. Many do not, and so cannabis is another tool to use for chronic pain. But the beauty of it to me, and what separates it from anything else medicinally for chronic pain, is that it is pain relieving, which is obviously your primary goal. I mean, have chronic pain, you want to relieve the pain. But most chronic pain patients come to a point where they realize and accept that they're going to have to live with some pain. Relieving 100% of the pain is simply not feasible, and their expectation is lowered that, hey, just give me what you can and let me have more peace with it and more quality of life with it. So that's where cannabis separates itself from all the other individual drugs and injections and things that you can do to help people with chronic pain where it lives. It does relieve pain in a fair number of people, so it satisfies that requirement. Many people with spine pain especially have muscle spasticity associated with it. Cannabis is muscle relaxant, all in one. Many people with chronic pain and other debilitating pain conditions have trouble sleeping because of their pain. It helps get you to sleep and keep you to sleep. There's three. It also treats what I like to refer to in the medical world as the secondary pain behavior. So what does that mean? Well, the primary thing is that you hurt, and that's how it's defined. But what are the consequences of living with chronic pain? Well, you're going to have a lower mood because you hurt. It just wears you down emotionally. You're going to have poorer sleep. You're going to socially withdraw because just don't feel like being happy-go-lucky and interactive. And that may include going to work. So, okay, you have opioids and things like gabapentin and
Mhm.
NSAIDs that help with pain, but none of them also address the mood, the sleep, and the quality of life deficits of an individual that has to suffer with chronic pain.
Mhm.
That is the essence of why I got excited in the first place about medical cannabis being available, because I knew it had all those potentials. So how do we get there though? And if you want to stop me, Brittany, go ahead. I'm kind of on a roll, but
You're on a roll. Keep rolling.
I'm on a big roll because it is more complex than you would think. There's not one size fits all. Pause Pain and Wellness is in place, and we get beat up on social media a little bit about our pricing, but we are everything that I say on these live episodes, our providers and our staff have had an orientation and get to hear me say in meetings all the time. This is our approach. So the value of your card and what you're paying to get managed with cannabis has to matter. And I want to make sure you know that it comes in different sizes and shapes.
Mhm.
We are there to help guide you because day one is just that. You got your certification. Now what?
Mhm.
Um, Now you've met the criteria. You have chronic pain. You have your card, and you're ready to go to the dispensary. But now what? I've never done this before. I've never taken this medicine. Do I have to smoke it? We guide you through all that. And we even have written recommendations for you to take to the dispensary to say, this is what they told me would be the best starting off point. Give it to the dispensary technician. They look at it and they go, okay, I think we have something that will fit.
Mhm.
Okay, that's more than giving you a card and saying, good luck, see you in a year.
Yeah.
So I had to get that in. Um, but what do you do? So you have to establish goals with the patient. So you have chronic pain, you have your card. Well, what are your goals? What are your expectations of what you think any drug should or could do for you? So, what are we trying to get out of this? Well, let's get in less pain. That one was obvious, and I've stated it a couple of times already.
Yeah.
How does it affect your sleep? Because depending on the strain, so we go back to real basics of management, indica and sativa. Indica is the one that probably has the best potential for heavy pain relief, but it's also the more sedative of the two.
Mm.
So, how do we reconcile that? Well, in the evenings and at night, it's the most sensible strain. So, you need to know that going in and saying, look, I'm taking it for chronic pain, but also have trouble sleeping. But I also have pain during the day and I work,
Yeah.
or I carpool my kids, or I have to do homework with my kids, or I just don't want to take a chance that it's going to make me foggy during the day. Okay, so now we have a plan. We know what we're treating, we know what our expectations are, and we know what our preferences are and goals of the therapy. Pain relief mostly at night, but I have some pain during the day. You're taking probably a higher dose of THC in an indica strain at night, but during the day, you probably want to have something, either a hybrid that's heavy sativa or a plain sativa. So sativa, I would say, has less likelihood to make you hyper or energized than it does to just not make you sedated. All
Yeah.
right. Some people get actually sharper cognitively, a little bit of a sharpness from it, believe it or not. Um, so that would be your daytime choice. And then you could, some people really tolerate indica all day long, but they've built a tolerance to that
Mm.
sedative effect. So they have a strain that's typically daytime, one that's mixed, and then one that's typically nighttime. Those are the bare basics of what you need to know going in to meet your goals. So I'm going to stop right there. But every condition, you got your card, you have the condition. You've kind
Yeah.
of done the logistic work. Now what? Now, how do we do cannabis? That's what we help you with. So you use chronic pain, but you can take each one of those diagnoses and establish your goals, expectations, expected side effects from what you go get, and start low and go slow. If you do those things, those core things, you have a very good chance that if you're going to respond and meet your goals, you'll do it without much
Hmm.
complication.
Yeah, interesting. Now, I have a question that came through, and they're talking about they're using it to medicate for chronic pain. However, they're noticing that there's certain terpenes that are maybe not offsetting the pain, but giving them headaches. So, one example is the carophyllene, and they're noticing that if there's terpenes that have carophyllene in it, is actually giving them headaches or migraines, even though they're treating for the chronic pain. What are some suggestions you have around that, and how can they still medicate, but if they're noticing certain terpenes are interacting with what they're actually medicating for?
Okay, that's a high complexity question, and there's a little bit more information one would need to sort some of that out. So let me explain. How are you sure that it's the carophyllene that is what is causing the headache? You, it would be very difficult to know unless you took a carophyllene containing and a non-carophyllene containing that were exactly the same other than that one ingredient. And I don't know if this individual has done that to determine that it's carophyllene, but let's just say it is, that they have done that. But that would be the only way to know. You know, when you're trying to figure out a dietary allergy,
Mm-hmm.
you cut everything out and you implement one thing at a time for a few weeks until you react. And then
Mm-hmm.
you know it was dairy or it was gluten or whatever it may be. So let's just assume that you've done that though. Well, um, you got to avoid the carophyllene. So you got to hope that your dispensary has whatever else was working in that without the carophyllene. I mean, that's where you are because you've identified the culprit. You have to keep it out, and
Mm-hmm.
that's where our guidance becomes more difficult because you can go to any dispensary you want, and we don't know exactly the components of all the products that they have.
Mm.
So, in our guiding you with our recommendations, we're using terms like CBD to THC ratio and edible versus inhaled versus topical to give you a little bit more flexibility when you go so you're not pigeonholed into a specific product um, because we don't know exactly what they'll have and we don't want you getting confused that let's say we said oh you got to have one with carophyllene. Well, out of the 150 dispensaries open, maybe only 10 have something with carophyllene even labeled to tell you that it's in it. Well,
Yeah.
that limits you because now you go and you go, well, they said carophyllene. So if you don't have that, I don't know what to get now. We're trying to leave it a little bit more open ended. So, very good question. Just
Mm-hmm.
ensure that you can really be secure that it's the carophyllene that's the problem.
Yeah,
Okay.
absolutely.
Um, Typically, though, side effects like headache and drowsiness, and even sometimes dry mouth to an extent, and dizziness, and some of these unwanted side effects do improve as you build a little tolerance.
Mm.
And the way to build the best tolerance for someone that's never done it is to go heavy with the CBD and lower with the THC.
Okay.
Because the CBD typically has less overall side effects at all. The THC is the one that can be so potent, especially with no tolerance built. But the CBD helps you build tolerance to the THC.
Interesting.
So definitely don't go as a new patient that's never experienced this or tried it or it's really ground zero. And certainly don't go with a THC only or high concentrated THC product. It's just not advisable because that's your most psychoactive component of the plant, Delta
Mhm.
9. And so you're at more risk of side effects until you build a tolerance. So you can go heavier on the CBD part lower on the THC, and then you gradually increase the THC concentration.
Mhm.
There's one product out there, I believe, that has the lowest THC concentration at 1 milligram, and I believe it's a gel cap.
Interesting. Very interesting. And that's
Yeah.
great advice. I've never heard that advice given before that you can build up the tolerance using the CBD. Now,
Yes.
let's talk about the other main categories that people are medicating for. And would you medicate the same way you'd medicate for pain as you would for, say, nausea and poor appetite? And now, when I say the same, I'm talking about how we're digesting it. Are we eating it? Are we smoking it? Are we putting on topically? And what are those strains? Are they different between the two and that you would typically use to treat the nausea?
Yes. So the strain, the actual ingredients would change a little bit, but the approach would be identical. Low and slow, more CBD to THC. So that is a basic tenet that every, especially inexperienced patient, should start with. All right, you can always be. I'm an anesthesiologist. Drugs and pharmacology were, whether I liked it or not, part of my brain that I can't shake because I had to learn so much of it. The basic tenet in anesthesia. People always joke, well, putting him to sleep is the easy part. Just push a bunch of drugs. It's waking him up that you get paid for. Well, there's some truth to that. And another basic tenet we always use is that you can always give more. You can't take it back once it's in the bloodstream. So don't get so don't be under so much pressure and excitement that you overdo it and have too many side effects and get disappointed or gun shy then. Low and slow is the way to go. So let's compare the chronic pain approach, which we talked about. You have most people with living with chronic pain. I consider it a 24/7 thing. It may hurt some more at some time, but all the time. So when do you need the relief and the improved function the most? Pick those times and then base what you're taking on how it might affect you at that time. So at night, you can go heavier THC, more heavy indica, and get away with it because you're going to sleep that off. In the day, you want to go with probably a heavier sativa, more CBD, lower THC, and work your way up to balance the side effects that you don't want, but they will improve. So let's take chronic. We got chronic pain now. Let's take anxiety. So first of all, anxiety is a very general term. There are tons of subsets of anxiety. There's situational anxiety. There's PTSD, which was a traumatic event that really ingrains a pathway in your brain from that event that you can't take that pathway out, and it gets triggered some by sometimes unconscious things and sometimes situations that just trigger that pathway to start, and you get depressed or anxious and panicky, or even agitated. So you have to really understand what your functionality is with your anxiety. So if you're just generalized anxiety, if you're just generally an anxious person and you just need something pretty much 24/7 to get you in a more settled place during the day, well, that strategy is going to be different than someone that has panic attacks, which are intermittent and not all the time. And sometimes they can predict them and sometimes they can't. And they may need a treatment now,
Mm.
as opposed to leveling myself out over the course of a day because of general anxiety all day. You have to figure out which one of those you are, because that's going to determine how often and really what form. So let's take an example. Let's say you're generally anxious and stressed. Your stress level is very high. It raises your cortisol. It affects your sleep. It makes you sharp, responding in social interactions. Your attitude's poor. You've recognized it. You need something to kind of settle your brain. And it will actually function better if you can settle it down and you know it. Well, that's going to be a kind of a dosing strategy where you're going to start low and slow, but you're going to be looking for more of a constant level in your blood and serum that's always available. Well, that's going to be more of like an edible, right?
Mm.
Or a a topical that you can rub on multiple times a day. So if it's for pain, you, you could use that during the day as well, and it's less systemic absorption in your blood. I didn't mention that, but that's a key. That's a key one, is to use a topical during the day that's less likely to cause side effects. But if you have the anxiety that comes with panic in a sudden onset, then you're going to need something that gets into your bloodstream quicker than an edible, which could take 1 to 2 hours. You don't have time for that. So that's going to be more of a tincture under the tongue or an inhaled form, like through a vape pen or just smoking, if you
Mhm.
have the ability to do that where you are. Because everyone needs to remember, I don't think they're going to cuff you and take you to jail if you're a medical patient and present a card, but you're not really supposed to do this in public.
Yeah.
Okay, it's easy to do an edible. No, it infringes on no one. They don't even know what it is.
Yeah.
There are vitamins at CVS that are gummies now. Nobody would really know or even smell that. But you can't light one up at work during a panic attack unless you have a really good relationship with your employer. So, um, access points are key too. Like, do you have access to any form of it at the time that you need it?
Mm.
Uh, and so those are important tenets. And for anxiety, the CBD tends to matter more than people think. It's not about THC kind of calming you down. This entourage synergistic effect with CBD and THC still matters for someone that's really anxious. In fact, you should use caution in a higher THC concentration until you have that tolerance built, because that's the one that can kind of contribute to making you a little bit more anxious, and it could exacerbate the
Mhm.
anxiety more.
Yeah.
So, you see where this is dynamic and it's a real medical process if you're not careful. If
Mhm.
if you just go to the gas station and get some Delta 8 gummies and you have a panic attack and pop one or two, you're really taking a chance on something bad happening. You need to know more than that about what you're taking and when and how what the potentials are for you to react to it.
Especially for anxiety, because like you said, it could exemplify that anxiety because you don't
That's
know
right.
what's in if you're getting it from the drugstore or from a gas station. At least now you can see the quality, the potency. There's so many different methods. So maybe you find out that, smoking it makes you a little bit more anxious. Well,
Yeah.
now you know that, so you can take maybe a capsule or a gummy or even like a tincture, and that
Right.
slow effect throughout the day might be what you need.
Yeah.
And I know that anxiety is not on the list. And I heard you say something earlier that fingers crossed that we're going to have some good news in March. Do you have any insight or intel that you can share with us of what you're thinking is going to be happening at that time?
Well, I believe the last I heard we were approaching 500 members of the Facebook Live. I would encourage every one of them
Mm.
to contact your legislators. They are in session now. There's legislation that has been drafted to revise the cannabis rules. Right now, I'm
Wow.
very happy with most of it, but encourage your legislators, if you have a condition that you think warrants it or you've been taking it and it's been working, let them know. Let them
Mhm.
know that you'd like to get more than a week supply at once. Although I told you before we started, Brittany, that I like to be in the middle. I'm a point counterpoint person. I have both the devil on my shoulder at all times, barking at each other across my face. So as I say that, be careful what you wish for, because let's say you're inexperienced and you go
Yeah.
into the dispensary and you get a month's supply of something you find 2 days later was not the greatest fit. Well, you're
Yeah.
out. You're out. You can't get more. You've got your limit. So be careful what you ask for. The weekly limits are an impediment to those that already are hitting their stride. And it's a
Mhm.
nuisance because they've got to go back each week. But I would caution that if they expand that to allowing you to get a whole month supply until you're comfortable with where you are with what it is you're taking, don't get more than a week's supply at once
Yeah,
until you settle
absolutely.
in. So that's a key point. But um,
Especially
yes,
if you don't know if you like it or not. And if you're just
right,
beginning, you're a new patient, I mean, you're not gonna really know what fits with you right off the bat. You're gonna have to try a couple of different products, experiment. You wouldn't wanna have all of this product on your hands and you are like, "Wow, this really doesn't make me feel good. It spikes my anxiety or it's not taking away my pain like it should." So
right,
until you find that sweet spot, then you can get a little bit more product on your hands so you know it doesn't run out because in this influx of the industry, dispensaries aren't always going to have the same thing every single month, every single
that's
week,
right.
right?
New products do come out. You'd have the chance to go back to them or your certifying practitioner and talk it out, and then go
Mhm,
back with a different plan and perspective. Okay, here's what I was taking. This is what it was doing. How can we change that? These are my goals. Um, so for anxiety, though, strain is crucial. You're probably leaning more towards an indica strain that's more sedative, so it balances the excitement of the
mhm,
anxiety. The sativa could be tricky. So it's not
mhm.
just the THC concentration, but the strain that has more potential to amp you up. You would want that if you were panicky.
Yep.
You need to know that. And so we've had patients early, especially that we we were even inexperienced, so that we weren't able to guide people like we are now after getting some of their feedback and learning more. I mean, we're all on the learning curve, but
Mhm.
now we've had a lot less incidents of callbacks for patients being disappointed because we get them started in the right direction because we're asking all these questions first and giving them a good game plan. That could take some time in the clinic.
Yeah.
So, our price point is $180 for that first visit, but we're taking your picture, we're helping you register, we're going through this completely, and we're completely accessible. And then when you come for your 6 month follow up, it's $60 forever. I mean, that to me is not pricing yourself out of reasonability. I mean, it's a medical visit that should take some time and warrants some a lot of considerations. And I just think there's a lot of people doing it a lot of different ways, and I would never tell anybody how to use their own medical license, but you have to know what you're getting or what you're paying for.
Yeah, absolutely. Now, I know we only have a couple minutes left, so if you have any questions, go ahead and drop them in the comment section. And if you're rewatching this and you have questions, put them in the group. We have a really large community now, like Dr. Kennard said, almost 500 members. So if one of them aren't able to answer, Dr. Kennard or myself will be able to hop in and answer. But we're here as a community to lift each other up, to lean on each other through experiences. So we can transcend belief and educate one another. Now, before we hop off, I want to say it again because I think it's really important for the Mississippi community to get involved. And you said legislation is happening now. How can they get involved? How can they make a difference and an impact and advocate for what they want in this medical marijuana industry?
Yes, if you go to the computer and you type in contact my legislator or senator or representative, they will ask you for your zip code and take you to a place where you can drop a comment to your legislators team. And they take those seriously. You're the ones voting them in or out. If
Yep.
they're not listening to you, they're taking their chances for reelection if they want to be. So it does matter. You think your voice may not be enough, and what could one measly person really influence? They need your vote. It matters. You don't have to give them $1,000 to listen to you. They
Mhm.
know if you took the time to drop them a comment or call their office and express that comment, or email, they give you an email and you send it, they know that you're more likely to go vote for what you believe in, and they
Yep.
will listen. And it could be just your call that when they're sitting there and that thing comes up for a vote, the last thing they heard about it was that one of my one of my constituents called about that. I remember, and it just, even if it's subconscious, makes them flip to approving these changes that I think are going to be great for the program.
Absolutely.
Um, I want to give, if I have just a second, I want to give a testimonial about a patient, and I've used this patient before, but it kind of ties it's the essence of what we're trying to do here. We're trying to improve quality of life. We're not purporting that cannabis has a lot of evidence or potential to cure anything. We don't have a lot of cures in medicine. Said that too. Very few. We
Mhm.
mitigate disease. We do it well. Um, but we don't have many cures. And cannabis is there to improve your quality of life. So we had a Parkinson's patient in his mid 70s that was skinny as a rail, appetite just destroyed, probably by depression and some of the drugs he was taking for his Parkinson's for the tremors. So he's socially not interacting, depressed, basically wasting away.
Mm.
What kind of life is that?
Yeah.
Came to us. I can't remember if it was recommended and he was referred or he came to us on his own. He started cannabis. He came back in a month later and he almost bebopped in the clinic to tell us that he was so proud to tell us how much his quality of life improved and his mood was clearly different, color in his skin. He had gained 12 pounds because he got his appetite back. He was sleeping better. He still had the tremors. He didn't care about the tremors. He had quality of life. You take every disease, that's what we're trying to accomplish with it. So when people talk about, well, where's the data? We don't have the data. Well, the data we have says it's very safe. And if it has a chance to improve your quality of life and it's safe, what else are you waiting on? Um, you can take too many ibuprofen for your osteoarthritis and burn your kidneys out very easily.
Yeah.
You almost cannot take so much cannabis that you ruin an organ, and you can't overdose with it to the point of death. You just get a dry mouth and a little dizzy, and you say, you know what, I'll leave that. I'm not going to take that. And you move on and you go to the next thing. You live to see another day. We've got to have that mindset about this. Have to. So,
Absolutely. Well, thank you so much, Dr. Kennard, for that. And as always, it's a pleasure having you on here and sharing your wealth of knowledge. And I'm excited for Mississippi to get involved in their community and speak up for what they want. We will
yes.
see you again, not this coming week, but the following week. So we're on a bi-weekly schedule now, and we'll continue to bring cannabis education to you. Have a great day.
All right. Goodbye.